Age-related macular degeneration, or AMD, is a breakdown of the macula. When the macula doesn't work properly, your central vision can be affected by blurriness, dark areas, or distortion. This condition affects many people as they get older.
There are two forms of AMD. One is called atrophic, or dry form, and the other is called exudative, or the wet form. About 90% of patients that get AMD have the dry form.
The retina is made up of many layers that are sandwiched together into a smooth surface. These layers work together, allowing us to see clearly. In people with dry AMD, the layer under the retina, known as the retinal pigment epithelium, or RPE, is affected by deposits, called drusen, as well as other age-related changes. These changes may cause vision to deteriorate.
Many people do not realize they have macular degeneration until they notice a problem with their vision, or until AMD is detected during a regular eye exam. Many people develop dry AMD as they age, and in many cases, it is very mild. However, the disease can progress to more advanced stages. People at high risk for developing later stage, or wet macular degeneration, are those with intermediate AMD in both eyes, or advanced AMD in one eye.
With wet AMD, abnormal blood vessels begin to grow under the retinal layers behind the macula. These blood vessels leak fluid or bleed, which further blurs or distorts central vision. About 10% of people with macular degeneration have the wet form.
Detecting wet AMD as early as possible is critical for seeking treatment and minimizing visual loss. Using the Amsler grid on a regular basis can help to detect vision changes as early as possible. For people with wet macular degeneration, there are treatments available. While they are not cures, these treatments can help stop the progression of blood vessels, which, if left unchecked, could lead to significant loss of central vision. If fluorescein angiography, or ICG, shows us the abnormal blood vessels are not directly under the central macula, it may be possible to treat them with standard hot laser therapy.
With laser therapy for wet AMD, the pupil is dilated using drops, and an anesthetic is given to numb the surface of the eye, and in some cases, to keep the eye from moving. A special contact lens is placed on the surface of the eye to help the surgeon see the retina. A high-energy laser beam is aimed at the tiny leaking blood vessels to seal them and to help stop them from growing.
Another form of treatment for wet AMD targets a specific chemical in your eye. This chemical, called vascular endothelial growth factor, or VEGF, is critical in causing abnormal blood vessels to grow under the retina. Several new drugs have been developed that can block the trouble causing VEGF. An anti-VEGF drug can help reduce the growth of abnormal blood vessels and slow their leakage, which helps to slow vision loss and in some cases may even improve vision. Also, there is a cold laser that we may occasionally suggest for some people called photodynamic therapy, or PDT. We here at Moore Eye Institute were the first to own the PDT laser after the FDA approved it in Pennsylvania. It is important to remember that only about 10% of all AMD cases are the exudative or wet form. Some of these wet cases may not be treatable or may not respond to treatment. But people with untreatable AMD won't become blind. They will still have peripheral or side vision.
This is what we have at Moore, a team approach where multi-specialists work with your family doctors and most importantly work with the family and work with you, whether it's to take vitamins or to use an Amsler grid, and then treat you, whether it's intravitreal injections and lasers or photodynamic treatment. There's so many different options. There is always something that can be done. We are going to do whatever it takes to help you.